They comfort the sick, the injured, and their families when they need it the most. They are the Diocese of Melbourne's Anglican Hospital chaplains. Stephen Delbridge is the Anglican chaplain at the Royal Children's Hospital, as well as the coordinator of Anglican health chaplains across 13 hospitals in Melbourne and Geelong. He says the core of his work is ensuring that there will always be support available for those in need.
Healthcare chaplaincy is concerned with people of faith and no faith, and healthcare chaplains work throughout our hospital system looking for the people who require support and care. We're different from a vicar who comes to visit a person of their own parish in the hospital. So they come in, they visit their parishioner. It's an extension of the parish ministry. A hospital chaplain is able to visit all kinds of people in all kinds of situations. We can take referrals from nurses or doctors or anywhere else in the treating team and go and sit with someone and treat and care for them in their time of need. A day in my life in the hospital begins with ecumenical prayers when we gather in the morning and stay in the sacred space and say some prayers together. Then I'll print out my lists for the wards that I cover in this hospital and make my priorities for the day. Then I go off and talk to the treating team, the nurses in the ward, and get referrals from them and make a ward round, work my way around and talk to patients and families. Maybe beginning with the ones that I know already, the ones who are long-term patients or regular patients. So there are patients who've been here for 100 days or more, and there are patients that return every few months for another piece of treatment. So I might begin with them, and then I go and find the patients who are just in for a day or two. Maybe they've got bronchitis or some other illness that has brought them into the hospital for a few days.
Barbara Colliver is an Anglican priest and chaplain at Monash Medical Centre. She says that her and other chaplains' roles are dictated by the needs of the hospital's patients.
Any day I could be working in neonatal intensive care through to palliative care unit in the hospital. I work in ICU and CCU and in the general wards as well. My ministry covers the whole lifespan from pre-birth through to last breaths.
The broad role of a chaplain is not limited by denomination or faith, ensuring that everyone has access to spiritual support when needed, but there is also a strong emphasis on making sure that specific spiritual needs of everyone are attended to.
Chaplains are part of an ecumenical team. We have Catholics, Unitings, Anglicans, Salvos. We have people who are the Islamic chaplain, the Buddhist chaplain, and so on. We are all part of this team, and we can find the people that we need to support the people who are the patients and families of the people in the hospital.
Khan Doe is the Pastoral Care Service Manager at Western Health. He says that because there is such a diverse range of beliefs throughout Melbourne, it's important that each hospital has a variety of chaplains.
We've got people of different, denominations and also faith as well, to, I guess, bring about a more complete picture of the world and how people understand the world, and it's very important to have that diversity in our team.
Khan says that Anglican chaplains are a crucial piece of the puzzle.
Anglican chaplains traditionally at Western Health have been very well trained, so they bring a sense of familiarity with the world. I think the difficulty with a lot of clergy coming to pastoral care is that they bring a sense of clerginess and a congregational kind of viewpoint to patients at hospitals. But I think with Anglican chaplains who've been very well trained, and they can put different hats on. They can take their priest hat, they can put their priest hat on if they need to. They can put their Christian hat on if they need to, or it can simply be put on their human hat if they need to as well. So the flexibility and adaptability of Anglican chaplains has been a crucial part of our service here. So.
The work of a hospital chaplain is by no means an easy task, but hospital chaplains are drawn to the role by a great desire to help those who need it the most.
So I'm a hospital chaplain because I love being with people in their situations of life. I might be with somebody when they get the good news, the treatment has worked, they're going home. I'm also with people at the worst times of life, the treatment has failed, they're family member is dying or maybe died, and we bless and hold them in that moment of need. That's what motivates me as a hospital chaplain, to be with these people in their time.
You're not just dealing with illness, you're actually dealing with the whole of life those people bring to the situation, which absolutely intensifies it. And that's the edge at which we work, which is really profound and really challenging. It is an extraordinary privilege, the work that I do. It does take me into dark and difficult places, which is the places that people often are when they're experiencing major life challenges in terms of their own state of health or the state of health of their children or loved ones. And in these dark and difficult places, I do encounter the presence and the compassion of God.
Ecumenical hospital chaplaincy is funded by grants from the state government through Spiritual Health Victoria, with the Diocese of Melbourne and Anglican Foundation Chaplaincy Fund also supporting Anglican chaplains. Recently, the state government grants have been cut, putting a greater burden on the Diocese and Anglican Foundation to ensure the service continues.
The consequences of the drop of funding is that we won't be able to supply the same number of chaplains to support people in their time of need, to be the face of the church at work in the hospitals of this city. So it's hard to keep it going with the resources that we have. We always need more. We're always reaching out to more people in more situations across these healthcare systems.
Hi, I'm Sharon Osborne, Executive Officer of the Melbourne Anglican Foundation. The Foundation started the Chaplaincy Fund in 1992 with a purpose to raise money for hospital chaplaincy in Melbourne and Geelong. We can't do this without the support of our donors, and I urge you to make a donation. Thank you for your support. Without you, our donors, the chaplaincy program would not be possible.